Hi, Dr. Shoke here. So what makes a great facelift or a natural facelift or a facelift that's not detectable? What about all those people you see that have had facelifts and all you know is they just look naturally youthful and younger than their age, as opposed to the ones that look so clearly and starkly obvious and that no one wants to ever have a facelift if all of them look like that? Well, you start with the proper pull of the skin because that really is the foundation for a natural facelift. And what is that? Well, it's naturally a pull upwards in the cheek and backwards in the neck. It's very difficult to create an unnatural look when you pull against the gravity that brings the face down here and here. So it's up here and back here. Well, why would not everyone do that kind of facelift? Well, there's a couple of reasons. Number one, it's harder to do a natural facelift with short, small incisions, which is, of course, naturally the tendency any patient would want is to have the smallest, shortest incision possible. Of course, if you can hide those incisions and make them hard to see, it really is more important that the appearance of the face is natural, youthful, and harmonious, as opposed to being one that because you saved a small incision, which will usually heal and be undetectable, you tried to get by with a mini facelift that was never going to achieve the goal. So the first thing is the vector or the pull of the face. And the second thing is that if a patient's expectations are X and the surgeon's expectations are Y, you never usually meet in the middle. So a great facelift can also be, even though it may be natural, one that doesn't meet the patient's expectations. So I tell patients that probably the most important part of the surgery is the preoperative evaluation and consultation, when we determine communication-wise what the patient wants and what can be done with their particular anatomy. So I hope that's helpful. I think those are the two most common issues. Number one, a natural, undetectable facelift that's very achievable. And second, making sure that that appearance that the surgeon is going to create matches the patient's.